Hey YouTube fam, welcome to my YouTube channel and thanks for clicking on this video. Today's video lecture is going to be very interesting because in today's video lecture we are going to cover up three most important topics. The very first topic we are going to cover is selective directly acting adrenergic drug, which is mainly working on our beta 3 adrenergic receptor. The second concept that we are going to cover in today's video lecture is about indirectly acting sympathomimetic drug, and we will also say its therapeutic use. The third main concept is about mixed acting sympathomimetic drug, and we will also say its therapeutic usage. But before we really go into the details of today's video lecture, लेट अस रिवाइज जो हमने प्रीवियस वीडियो लेक्चर में डिस्कस किया था. इन द प्रीवियस वीडियो लेक्चर वी मेनली डिस्कस्ड अबाउट डायरेक्टली एक्टिंग adrenergic drug. In directly acting adrenergic drug, we saw our main drug that is a dopamine, and always remember ये जो dopamine होता है it is having a dose dependent phenomenon. In the low dose, our dopamine can stimulate our D1 receptor, and D1 receptor कहाँ पे प्रेजेंट होते हैं? वैसे तो सारे के सारे ब्लड वेसल्स में प्रेजेंट होते हैं, but the maximum concentration of D1 receptor is present on our renal artery. So whenever we give low dose of dopamine, it can stimulate D1 receptor and it will dilate our रीनल ब्लड वेसल्स. जब हम डोज को थोड़ा सा बढ़ा देते हैं, दैट मीन्स इन मॉडरेट डोजेज our dopamine gets an add-on effect, that is of activating our beta 1 adrenergic receptor. In high dosage, we saw that our dopamine can also stimulate alpha 1 adrenergic receptor. And ये जो डोज डिपेंडेंट फिनोमिनन है, it is one of the most important asked questions in many competitive examination. So ये पता होना बहुत जरूरी है. We also talked about the therapeutic usage of dopamine. Dopamine is a drug of choice in case of shock along with oliguria. Then we saw a more selective drug which is similar to our dopamine molecule, but it is not having any action on our D1 receptor. Its main action is on beta 1 adrenergic receptor, and the name of that drug is dobutamine. We talked about the selective D1 receptor agonist, and the name of that drug is phenoldopam. Then we studied about nasal decongestant and कौन से ऐसे ड्रग्स होते हैं which can be used as nasal decongestant. Then we saw about the selective alpha 1 adrenergic receptor agonist, and we also saw about the centrally acting alpha 2 adrenergic receptor agonist and centrally acting alpha 2 adrenergic receptor के examples हमने देखे थे. Mainly we have two important examples. The very first one is clonidine and the second one is alpha methyl dopa. Remember, alpha methyl dopa is one of the most safest drug which is used in case of hypertension in pregnancy. ये बहुत बार क्वेश्चन पूछा गया है, so that's why we discussed it. Now let's start with our today's video lecture. But before going directly into our indirectly acting sympathomimetic drug, I want to talk about one more important drug जिसका के therapeutic action important है. If you can recollect from our introductory video lecture, हमने adrenergic receptor को दो categories में divide किया था. The very first one was alpha adrenergic receptor and the second one was beta adrenergic receptor. Now for now, just forget about alpha adrenergic receptor and let's focus mainly on our beta adrenergic receptor. बीटा एड्रेनर्जिक रिसेप्टर को हम फर्दर सब क्लासीफाई कर सकते हैं into three main classification. The very first one was beta 1, the second one was beta 2, and the third one was modified version of our beta 1 adrenergic receptor, that is beta 3. If you can also recollect what is the location of beta 3 adrenergic receptor. So in our video lectures previously we discussed कि ये जो बीटा 3 adrenergic receptor होते हैं, they are present on our adipocyte. Now whenever this beta 3 on our adipocyte is stimulated, it stimulates the breakdown of triglyceride into free fatty acid. In short, it will promote the breakdown of lipids, and breakdown of lipids के लिए we have a very special term that is known as lipolysis. Now you need to understand one more important location of beta 3 adrenergic receptor. This beta 3 adrenergic receptor is also present on our urinary bladder. Now whenever we stimulate that particular beta 3 adrenergic receptor present on our urinary bladder, it will relax the urinary bladder, and because of relaxation there will be reduction in urine output. Now the question is, in which condition we need to reduce the urine output? There is a condition that is known as overactive bladder. In overactive bladder, there is a problem with the urinary bladder functioning, due to which there is a sudden need to urinate. So just think कि अगर मेरे पास कोई ड्रग है which can bind to our beta 3 adrenergic receptor which is present on the urinary bladder, it will relax the urinary bladder, and ये जो frequent urge of urination है that will be suppressed, and the name of that particular drug is Meera Berberin. So by giving such drugs, that is Meera Berberin, it will relax the bladder and it will reduce the urge to urinate frequently. Remember this is a new drug which the scientists have found, and ये बहुत important है, काफी बार MCQ में पूछा जा चुका है. Now let's move on to our today's second concept, that is indirectly acting sympathomimetic drugs. Now what is the main difference between directly acting and indirectly acting sympathomimetic drugs? जो हमारे directly acting sympathomimetic drugs थे, they used to directly stimulate our adrenergic receptor. But indirectly acting adrenergic receptor क्या करते हैं? They do not directly bind to our adrenergic receptor, but they increase the concentration of noradrenaline in the synapse. Whenever the concentration of noradrenaline in the synapse is increased, more norepinephrine will be present, and more norepinephrine can work on our adrenergic receptor, so हमें ज़्यादा response मिलेगा, and उसके वजह से हमारा जो sympathetic activity है that will be increased. So such drugs which are indirectly acting sympathomimetic, they act by increasing the release of noradrenaline in the synaptic cleft, or by inhibiting the reuptake of noradrenaline. When we talk about the classification of indirectly acting drugs, we can classify them into two main types. The very first one is reuptake inhibitors, and the second one is action by displacement. Now first, let us talk about reuptake inhibitors. So as you can see on your screen, let's consider this green color oval shaped is our nerve ending. This is our adrenergic nerve ending. Now ये जो टायरोसिन है, with the help of tyrosine transporter, it will enter into our nerve ending and ultimately it will be getting converted into dopamine. Now this dopamine should enter into our membrane bound storage vesicle and इसका जो transportation है, that is facilitated by a very important transporter and the name of that transporter is VMAT2. What is the full form of VMAT? VMAT stands for Vesicular Monoamine Transporter Type 2. So as you can see कि ये जो dopamine cytoplasm में था of our nerve ending, now it has entered our storage bound vesicle. Now in the vesicle we have a very important enzyme and the name of that enzyme is dopamine hydroxylase. With the help of this enzyme, it will convert our dopamine into norepinephrine and our storage vesicle will be full of norepinephrine. Now जैसे ही action potential आएगा, there will be influx of calcium and with the help of this calcium, ये जो membrane bound storage vesicle है, that will fuse with our nerve ending vesicle and after the fusion जो भी content है of this storage vesicle, that is norepinephrine, that will be released in the synapse. As you can see here, here is our norepinephrine in the synaptic cleft. This norepinephrine then can work on our adrenergic receptor and depending upon कौन सा adrenergic receptor present है, it will show its particular response. Now let's talk about the fate of norepinephrine. Majority of our norepinephrine is getting again retransported or we can say reuptaken back into our nerve ending and ये जो reuptake करने वाला transporter है, we call it as norepinephrine transporter और simply short form में हम उसे बोलते हैं NET, NET. Now just think कि अगर मेरे पास कोई ड्रग है which can bind and block this norepinephrine transporter, do you think कि जो norepinephrine majorly uptake होता था, will it go back into our nerve ending? The answer is no. Why? क्योंकि हमने ट्रांसपोर्टर को ही ब्लॉक कर दिया. That means more norepinephrine will be present in the synapse. That means ज़्यादा concentration होगा. ज़्यादा concentration के वजह से more potently our norepinephrine can work on our adrenergic receptor and उसके वजह से जो sympathetic activity है that will be enhanced. So such a drug which are working by reuptaking inhibitors, they are cocaine and we have tricyclic antidepressants जिसे हम short form में TCA भी बोलते हैं. ये ड्रग्स क्या करेंगे? It will bind here and it will block our norepinephrine transporter and उसके वजह से जो concentration है of norepinephrine that will be increased. Now इसे हमने indirectly acting drugs के classification में क्यों डाला? Very simple, because if you see the definition, ये जो drugs होते हैं, it increases the release or it increases the concentration of noradrenaline in the synaptic cleft by inhibiting the reuptake of noradrenaline. Now let's move on to the second category of indirectly acting drugs, that is action by displacement. Now ये जो action by displacement है, we will understand जब हम amphetamines पढ़ेंगे. So let's start our discussion with amphetamines. Talking about amphetamines, these are synthetic. Synthetic का मतलब ये ऐसे substance होते हैं which are produced in laboratory. This amphetamine is not having any catechol ring और कैटेकॉल न्यूक्लियस, इसीलिए दिस कंपोनेंट्स आर नोन एज नॉन कैटेकॉल अमीन्स. सो एम्फेटामिन्स आर सिंथेटिक नॉन कैटेकॉल अमीन वाले कंपाउंड्स. नाउ दिस सेंट्रल एक्शंस का मतलब होता है एक्शंस ऑन अवर central nervous system of amphetamines is largely mediated by the release of noradrenaline from the adrenergic neurons in the brain. Now जैसे ही ये noradrenaline रिलीज होता है by displacement, हम देखेंगे after a displacement जो बाहर noradrenaline जाता है, it can mainly take place by two important processes. The very first one is exchange diffusion and the second one is reverse transport, which involves our transporters like NET, that is norepinephrine transporter, DAT, that is dopamine transporter, and we have VMAT2. Now let us see the mechanism of actions of amphetamine. But before, let's understand this figure. In this figure, you can see ये जो light green color का shape है, that is oval shape. Let's consider this particular shape as our nerve ending. Nerve ending में we saw there is a transporter, and let's consider this transporter as norepinephrine transporter. This star color shaped molecules are our amphetamines. This blue color shaped structure, let's consider it as our VMAT transporter. This green color, that is dark green color वाले components को let's assume it is our norepinephrine. This yellow color shaped circle is our storage vesicle जहाँ पे हमारा norepinephrine store होता है. This is our synaptic cleft, or simply it is our synapse, and here are your adrenergic receptor जहाँ पे ये जो norepinephrine है after the release it will show its action. Now let us read these sentences one by one and let's see कि ये कहना क्या चाहते हैं. Amphetamines enters the adrenergic neurons by utilizing the neuronal norepinephrine transporter or dopamine transporter and then enters the storage vesicle through VMAT2. So as you can see on your screen, here is our amphetamine. ये जो amphetamine है, it uses this particular transporter. If it is this particular nerve ending is releasing norepinephrine, it will be having norepinephrine transporter. अगर ये nerve ending dopaminergic होती, that means this nerve ending is releasing dopamine, so वहां पे जो transporter होगा, it will be dopamine transporter. So depending upon which neuron is there, this particular amphetamine will enter into our nerve ending. As you can see, amphetamines बाहर है, and after utilizing this particular transporter, it has been replaced, or we can say ये अंदर चला गया into our cytoplasm. Now after this particular amphetamine present in our cytoplasm, it will use this VMAT2 transporter and it will get inside our storage vesicle. In this storage vesicle, as you can see, here are our star molecules. Now जब हम बात कर रहे थे about the displacement, let us understand what do we mean by the concept of displacement. Let's suppose कि एक class है and in that class we have 100 students and हर एक बच्चे के लिए एक proper benches है. अगर 100 students complete हो गए, that means 100 benches occupied हो गए, and if there are extra 50 students coming, वो क्या करेंगे, ये जो बच्चे बैठे हुए हैं उन्हें displace कर देंगे. That means they will occupy their position by pushing them outside the class. Similar thing is happening in this particular scenario. यहाँ पे norepinephrine was already present. But remember, ये जो storage vesicle होता है, it is having a particular capacity to store norepinephrine. So जैसे ये amphetamines अंदर आएंगे, this amphetamine will push our norepinephrine molecules and ये कहाँ जाएंगे? It will be released into the cytoplasm. And ये जो process होता है of displacing, this is very very important because our amphetamines will displace this norepinephrine into the cytoplasm. Now, it then displaces the stored noradrenaline into the neuronal cytoplasm, most of which is released into the synaptic cleft either by exchange diffusion or by reverse transport. Let's understand this. Norepinephrine cytoplasm में आ गया. Now this norepinephrine has to be released into the synapse. Why? क्योंकि synapse में जब ये release होगा, only then it can show its effect on our adrenergic receptor. Now इसमें दो mechanisms है. The very first one is exchange diffusion. So अभी दिवाली का ऑफर चल रहा है and you know हम बहुत सारी चीजें एक्सचेंज करते हैं. एक्सचेंज मतलब एक चीज हम लोग देते हैं एंड उसके बदले में हमें कुछ मिलता है. सेम थिंग इज हैपनिंग हियर. आवर एम्फेटामिन इज गोइंग इनसाइड दिस न्यूरोनल साइटोप्लाज्म एंड उसके बदले में दिस नॉरएपिनेफ्रिन इज कमिंग आउट. एंड अगर ये नॉरएपिनेफ्रिन बाहर आया, दैट मीन्स कॉन्सेंट्रेशन बढ़ेगा and concentration बढ़ा, so more potently it can act on our adrenergic receptor, and this particular phenomenon is known as exchange diffusion. The second thing is about the reverse transport. Look, ये जो norepinephrine transporter है, usually it is in ये क्या करेगा, norepinephrine को लेगा and it will transport this norepinephrine inside this particular neuronal cytoplasm. But यहाँ पे क्या हो रहा है? It has reversed a direction. Usually norepinephrine should go inside, but in this particular case norepinephrine is coming outside. That means उसका जो direction है that has been reversed, and this particular mechanism is known as reverse transport. Now और एक चीज, the release is not exocytotic and it does not require calcium ions. जब हमने previous में डिस्कस किया था about this, हमने बोला था कि कैल्शियम आएगा and calcium will promote the fusion of stored vesicle with our nerve ending wala vesicle, and this particular fusion is known as exocytosis and it requires calcium ions. But in case of amphetamines, calcium की कोई जरूरत नहीं है. The amphetamine is self-sufficient to release our norepinephrine into the synapse and increase its activity. Now डिस्प्लेसमेंट का सिंपल यही मतलब याद रखना. अगर हिंदी में बोला जाए धक्का मारना, जस्ट रिमेंबर दैट एम्फेटामिन्स अंदर जाएगा एंड इट विल पुश अवर नॉरएपिनेफ्रिन इनटू द साइटोप्लाज्म एंड अल्टीमेटली वो जो रिलीज्ड नॉरएपिनेफ्रिन है दैट विल बी ultimately working on our adrenergic receptor and thus increasing our sympathetic activity. Now, what is the effect of amphetamine? It is a CNS stimulant drug. It increases alertness and attention span. It gives a happy feeling. Happy feeling के लिए we can use a word that is euphoria. It reduces sleep, that means it promotes insomnia. It increases motor and physical activity, and also sometimes it can give rise to tremors. Now, इतने सारे इफेक्ट में से you need to remember just two effects. Number one, it increases attention span, and number two, it reduces sleep. Now, why I told you to just remember two important effects of amphetamines? Because यही दो important effect को लेके we will treat some kind of conditions. Let's see the therapeutic use of amphetamine. Amphetamines can be used in case of narcolepsy. Now, what do we mean by narcolepsy? Narcolepsy is a sleep disorder which is characterized by recurrent episodes of uncontrollable desire for sleep. यानी कि जो पर्सन नार्कोलेप्सी से सफर कर रहे हैं दे यूजुअली गेट स्लीप अटैक्स, एंड ये स्लीप अटैक्स इतना भयानक होता है दैट पर्सन कैन नॉट कंट्रोल इट. सो यहाँ पे वी कैन गिव एम्फेटामिन्स. व्हाई? बिकॉज अवर एम्फेटामिन reduces the sleep. So amphetamines improves the condition of narcolepsy by its CNS stimulant effect. Now हम amphetamines use कर सकते हैं, but there is an approved drug which is a drug of choice for narcolepsy, and the name of that drug is modafinil. Remember that. This amphetamines can also be used as anorexant. Anorexant का क्या मतलब होता है? ये ऐसे ड्रग्स होते हैं विच सप्रेसेस अवर एपेटाइट. एपेटाइट का मतलब होता है भूख. सो अगर हमने भूख को कम कर दिया दैट मीन्स द पर्सन विल ईट लेस, एंड अगर पर्सन कम खा रहा है उसका जो बॉडी वेट है वो रिड्यूस हो जाएगा. सिमिलरली अवर एम्फेटामिन इज डूइंग सच काइंड ऑफ थिंग्स बाय सप्रेसिंग द हाइपोथैलेमिक फीडिंग सेंटर. So amphetamine का और एक यूज है that is anorexant. Most important is the third one. It can be used in case of ADHD. Now the question is, what do we mean by ADHD? ADHD stands for Attention Deficit Hyperkinetic Disorder. As it is very evident, attention deficit का सिंपली ये मतलब होता है that a person or a child is not able to concentrate at one particular thing. उसके वजह से क्या होता है that person or the child becomes very hyperactive. So in this particular case, primary problem is attention deficit. As that child is attention deficit, उसके वजह से he is hyperactive. That means hyperkineticity is our secondary problem. So in this particular case, हम अगर attention बढ़ा दे, then the hyperkinetic problem can get reduced, and in that particular case, again we can use amphetamine. Why? Because our amphetamine can increase the attention span, and इसमें भी एक drug of choice है that is methylphenidate. So methylphenidate is a preferred drug for the condition of ADHD. That was all about our amphetamines and indirectly acting sympathomimetic drugs. तो पहला जो हमने एक स्टेटमेंट देखा था कि ये जो indirectly acting drugs होते हैं they are mainly releasing noradrenaline in the synapse. These agents actually enter the neuronal cytoplasm by the same transporter that is responsible for reuptake of noradrenaline, and ये particular statement हमने बहुत अच्छे से देखा है in case of amphetamines. ये जो ड्रग है it enters the storage vesicle, and उसके बाद it will displace the stored noradrenaline. So remember these points. Now let's move on to our mixed acting sympathomimetic drugs. Now, what do we mean by mixed acting sympathomimetic drugs? ये ऐसे ड्रग होते हैं which can directly stimulate our adrenergic receptor and also it can indirectly increase the concentration of norepinephrine. That means ये ऐसे drugs है which is having two actions. Number one, direct action and number two, indirect action. So let us see some of the examples of mixed acting sympathomimetic drugs. Very first drug is ephedrine. Now remember, don't confuse ephedrine with epinephrine. Epinephrine is adrenaline. That is a purely directly acting sympathomimetic drug. बट यहाँ पे ये एफिड्रीन लिखा है, इट इज नॉट रिटन एपिनेफ्रीन. बहुत बार बच्चे कंफ्यूज करते हैं, सो डोंट गेट कंफ्यूज्ड. एफिड्रीन इज अ मिक्स्ड एक्टिंग एड्रीनर्जिक एगोनिस्ट with direct action on our alpha 1, alpha 2, beta 1 and beta 2 adrenergic receptor, and also it will release noradrenaline from the synaptic nerve ending. Now just remember, just thoda sa logically you think, what will be its pharmacological action? This particular ephedrine can work on our alpha 1. alpha 1 कहाँ पे होते हैं? ब्लड वेसल में होते हैं. ब्लड वेसल में whenever we stimulate our alpha 1 adrenergic receptor, it will constrict. So this particular drug is also constricting our blood vessel. It is cardiac stimulant. Why? Because in our human heart we have beta 1 and this particular drug can also stimulate beta 1 adrenergic receptor. Bronchodilator. Why? Because in our lungs we have beta 2 adrenergic receptor and again this drug can stimulate it. ये जो drugs है, it can also be used as a nasal decongestion. Why? Because of its alpha 1 action. And also in our introductory video हमने देखा था कि जो आई में हमारे मसल्स होते हैं we have alpha 1 and अगर हमने वो alpha 1 को stimulate किया it will dilate our pupil. That means ये drug as a mydriatic भी हम use कर सकते हैं. So now let us see कि what are the important usage or we can say therapeutic usage of ephedrine. Intravenous ephedrine is a drug of choice to treat hypotension due to spinal anesthesia. Question is why? Very simple. अल्फा 1 को स्टिम्युलेट करेगा, वेजोकंस्ट्रिक्शन होगा. वेजोकंस्ट्रिक्शन से क्या होगा? टोटल पेरिफेरल रेजिस्टेंस बढ़ेगा and because of that increase in total peripheral resistance there will be increase in the blood pressure. Now second thing, beta 1 को भी स्टिम्युलेट करेगा. beta 1 को अगर स्टिम्युलेट किया तो कार्डियक आउटपुट बढ़ेगा and because of increase in cardiac output again our blood pressure will increase. So ephedrine can be used in case of hypotension because of spinal anesthesia. It is a vasopressor of choice in pregnancy. Now why? Because it is having beta 2 mediated vasodilatory action and because of this particular action it is not interfering with the placental circulation. तो यहाँ पे वेजोप्रेसर का क्या मतलब होता है? वेजोप्रेसर उन ड्रग्स को बोलते हैं which can increase the blood pressure whenever the blood pressure is low. So ephedrine is a drug of choice. Why? क्या फर्क पड़ता है कि अगर हमने अल्फा 1 को ही डायरेक्टली स्टिम्युलेट कर दिया और भी से अगर मेरे पास कोई डायरेक्टली एक्टिंग अल्फा 1 एगोनिस्ट है, why I can't use it? The answer is very simple. जब हम ऐसे ड्रग्स यूज करते हैं which is having its main action on alpha 1 adrenergic receptor, वो जो सर्क्यूलेशन है that is प्लासेंटल सर्कुलेशन को हिंडर कर सकता है, बिकॉज वी नो दैट व्हेनेवर वी स्टिम्युलेट अवर अल्फा 1 adrenergic receptor it will cause vasoconstriction. बट एफेड्रिन का क्या फायदा है? इट इज हैविंग बीटा 2 एक्शन एज वेल. अल्फा 1 भी है एंड बीटा 2 भी है. सो देयरफॉर ये जो दोनों एक्शन है दे विल बैलेंस आउट and relatively there will be vasodilation and it will not interfere with our placental circulation. Hence, the vasopressor of choice in pregnancy is ephedrine. This particular ephedrine was also used in heart block, narcolepsy and more frequently in cases of bronchial asthma. But हमारे पास बहुत सारे advanced drug आ चुके हैं which are selective in nature. So हम use कर सकते हैं, but now this ephedrine has been replaced with more selective drugs. This ephedrine and pseudoephedrine, they are present in cold remedies for nasal decongestion and also bronchodilatory action. Let's move on to our second drug, that is mephentermine. Now ये जो ड्रग है इट इज डायरेक्टली एक्टिंग ऑन अवर अल्फा 1 adrenergic receptor and also it will release in some amount noradrenaline. That is the indirect action. This by stimulating alpha 1 adrenergic receptor it will cause vasoconstriction. Vasoconstriction अगर होगा it will increase the blood pressure. So simply we can use this particular drug, that is mephentermine, to raise the blood pressure in cases of hypotensive states. Last one, you know our friend that is dopamine. This dopamine has a direct action and also it can indirectly release noradrenaline. But remember, ये जो direct action है that is a dose dependent phenomenon, and dose dependent phenomenon we covered it in our previous video lecture. So that's it for today's video lecture. If you find value in my content, please do subscribe to my YouTube channel, press that bell icon, like this video and share it with your friends. See you in the next video. In the next video we will see some kind of MCQ based questions and we will move on to our sympatholytic drugs. So see ya until the next video. Take care. Bye bye.